Good morning. Many thanks for your question. So, recovery time from arm surgery. That kind of depends on the extent of surgery you have. Arm surgery is a bit variable. So, when assessing someone for arm surgery, you look at the arm and the contour. And in some cases, the bump ends here and the scar will end there. And in some cases, it ends all the way out here. And that's where the scar will end too. Maybe I could show you an example. Yeah, here we go. So, if you look in this lady's case, she's got excess skin of her arms and the convexity comes all the way to the elbow. So that's where the scar extent will have to be in her case. If you end the scar there, then she'll still have this lump, even if you try to hollow that out with liposuction and with open excision. So you've got to do that. And there's, in addition, usually you can see it on this side, a T extension that goes in the armpit crease. But in some people's cases, the scar isn't that long, it's much shorter. And that does affect the recovery time somewhat. In fact, I can show you some after pictures. Yeah, so here she is, same person, after arm reduction surgery. And I try to place the scar so that it sits along that line. And you can see from the front that it's a nice location because you cannot see the scar from the front or behind in that view. But when your arms are by your side, you would be able to see it posteriorly. People do often wonder and worry about the scars from arm reduction surgery. I'm really zoomed in, I'm sorry, because I don't want to show you her face. People worry about the scars from arm surgery, but they tend to settle pretty well. These are very early. This crisscross appearance is because I get patients to tape my scars for 3 months. The tape has been removed for the photo and then put back on again. Tape for 3 months. So this is within that 3-month period, and I'd say this looks at about 1 month. And then later on, post 3 months, when the taping has gone, the scar should stay pretty much the same. So the T scar and a nice fine pale scar. So back to your question. Recovery time, well, you're in hospital for 1 night. I no longer use drains for an arm reduction. In hospital overnight, you're wearing garments for 4 to 6 weeks, tight compression garments. You can get back to sort of normalish activity after a week, even within that first week, by which I mean tapping away at a keyboard, carrying the contents of a light paper bag, but not a heavy plastic bag, that kind of thing. If you do physical work, you've got to delay it longer. Going to the gym, I'd say leave that 6 weeks or so before you get started. You can do lower body stuff before then if you want. As for cost, it's massively variable, and I guess the costs are somewhere between about £4,000 and £10,000, depending on whether you're at the low end or high end, and I'm somewhere in between that, probably in the middle of that, I should think. So that's it. Can I recommend a surgeon? Yeah, me. I can recommend me, but there are lots of surgeons who do this regularly, or many of whom will do a great job. So actually, honestly, the most important thing is to find someone good, who's local to you, who you can travel to, who you trust, you've got a good rapport with, and who has all the proper accreditations. And if you look at my YouTube page, I show you how to research your surgeon too. Okay, I hope that helps. Take care. Bye-bye now.